Hello, doctor. How are you this afternoon? Welcome back to another episode, everyone, for Ingredients for a Better Life. I'm DNA Chef Jay, again, joined by Dr. Robert Nettles, MD, the Chief Medical Scientist and founder of the Stop and Regrow Hair Regrowth Program. Good afternoon, doctor. Welcome back on this special Groundhog's Day edition. Apparently, the groundhog did see his shadow, so another 6 weeks of winter, if you subscribe to that kind of thing. How are you, doctor?
I'm doing great. Today better than yesterday, Jay, and I hear tomorrow better than today. So you and I were sticking around.
That's yeah, well, that's for sure. I mean, I have plans regardless of what the groundhog sees, here nor there. I don't believe in that stuff anyway. But it's good to see you again, doctor. You're looking good, and again, let's get right to it. Let's have at it. So today, I'd like to jump right into a question that I get asked very often, and a lot of other people on the team that answer these complimentary video and phone call assessments online. And it is, what time frame can people expect to regrow their hair? And I know that's kind of a loaded question because everyone's different. Everyone has a different level of hair loss and a different course of treatment. But people kind of ask that loaded question, blanket statement of when can they expect to see some results?
A very good question, Jay. So, Chef Jay, the time frame of growing hair back, well, at least they're asking good questions, right? Because they're usually on products and treatments and programs, Jay. It's not as if the clients we see have never tried anything. I'll share with you a couple of photos, and we'll share some of the things they've tried before they've gotten to us.
Yep.
So I'm going to show a couple of share a couple of photos with you and the followers, and they can see the photos of the before, and this is after all of the other treatments that are available on Earth.
Yep.
All of these people are affluent clients. Usually, we started out in Beverly Hills, California, and now we're in Santa Monica, California. And anyone in the United States, if you're familiar with anything about California and Los Angeles, Santa Monica, and Beverly Hills, this is where the affluent rich people live. And they've tried everything that money can buy. And we'll show you some of the photos of the afters of everything they've tried. And then you'll see us taking them and moving them forward. And the
Right.
question is, hey Doc, what can you guarantee and what can I expect? And as you mentioned, Jay, it starts with you, right? Until the blood work, no one could even possibly answer that question because there are so many things that cause the hair loss. You and I have to get in there and figure it out. And some of the things is going to be dependent upon their changes with their nutrition and their habits. So it really depends on how much the person values and how committed and dedicated they are on the program. So let's start from the question of a committed, dedicated person, Jay, who says, Dr. Nettles, I will follow everything that you say. What can you guarantee me and by how many months? Let me share a couple of
Yep.
slides with you and we'll go over that exact question. And these, once again, Jay, these are going to
Yep.
be the committed people, the dedicated people that value hair more than LeBron James. Okay,
And
because obviously LeBron doesn't value hair because he didn't find us and he still has hair loss today. If you ever see LeBron James ever grow his hair back, you call this office and we'll tell you that we started him. Until you see hair grow on LeBron James, he has not found us and we're located in the same city. So
yep.
luckily and fortunately, you can be anywhere in the United States and even anywhere in the world and have a Zoom appointment with us, and we can review the blood work to tell you what caused your hair loss. And from that point, Jay, we can then give them a much better a time frame as far as what to expect at what time frame. And we had a patient today, super nice guy. Hair grew great within 12 months. He came in for his annual review, and hair's growing great. He came in very advanced. He says, hey, Doc, I'm as happy as a lark. How long do you think before I get that ponytail holder? About 2.5 years from this point today. Ecstatic,
Yep.
ecstatic and excited for a future of hair growing. So let me, if you don't mind, I'll share you a couple of those
Yep.
slides and you and I can just go through them one on one because it's an interesting story that I can share with some of the insights as far as the cases. But let me see if I can share my screen for you right here.
And there is truth to that because I know out of the people that I've started for their assessment process that for sure they come as the last road, the last train, because they've been through transplants, they've been through the keeps and the hymns and everything, and they're like kind of a victim, I'll say, of the big marketing. So they come to you as a last sort of a last ditch effort, and it's unfortunate, but it's very true what you're saying.
Yeah. All right. Do you see the screen now, Jay? You see the slideshow there?
Yep, I sure do. That's
Now,
six months.
yeah, now this is a great case of hair growing back within 6 months, but it's obvious that there's a circle missing here, and you see that that circle
Yep.
has closed in. So this is an alopecia areata. So there are lots of different causes. There's alopecia areata. There's telogen effluvium. There's androgenetic alopecia. There's allopenea. So all of those words and terms come from the blood work. We have to first see what the molecular underlying cause is so that we can accurately give it a correct diagnosis. So this young lady healed this well within 6 months. And then we'll see the next one here, Jay.
Now, is that from a friction or like a physical pullment of the hair or something like that? Or is that
Very, very good question. So alopecia areata, little circles of hair loss, comes from environmental stressors. And as soon as you remove those stressors, they should heal itself. The problem
okay?
is those stressors are hard to remove. So a lot of times we have to use some types of pharmaceutical agents to regulate the enzymes, which will also decrease the inflammation process inside the human body. So you can help someone with stressors or stress related activities by working on the enzymes inside the human body. And that's about 20% of men, and I would say about 10 to 15% of women.
So will they present with the inherited enzyme deficiency then in that case?
So in that case, Jay, we would have to first discover the blood work and find out, does she have two causes
Ah, okay.
of hair loss? A lot of times we see one, two, three different causes. If we're only treating one of those causes, for example, you mentioned keeps and hims and minoxidil and finasteride. Well, most of those dermatologist-based treatments come from physicians who
Yep.
do not understand the blood work and don't order the blood work. So that's number one. So without blood work and understanding what the causes are, they put them on a treatment program that might be treating one of the three, might be treating one of the two. Will it work? No way. Would it be an effective treatment that would have worked in conjunction with another program? And that's
Right.
absolutely. So we have to look at all of the underlying causes. The female before, she had only the environmental stressors, but no DHT free T ratio discrepancy. So there was
Yep.
no enzyme regulation issue. And this is how it can be very, complex, or it can be very simplified depending on how you apply the algorithm. But the algorithm helps us determine the underlying cause, which then leads us to the correct treatment, which leads to the outcomes that are positive every single time.
That's why it's super important to get that blood test, and why the internal doctors, and when you go for your checkup, they're simply unaware, I think, of these biomarkers you're talking about. Is the research you've done that correlate with hair loss? So they're still not aware of how these things correlate, and I guess that's why your test is special and unique, as it is over time you've found these specific biomarkers that correlate to hair loss, and specifically what's presenting both naturally or inherited, and what could be surrounding. So like you said, it's a complex yet a simple approach, but all depending on that blood work.
You mentioned it, Jay. Today, it's a piece of cake. And it's literally a piece of cake, because the recipe for the birthday cake is how we start the conversation in the office. And
Yeah.
the recipe for the birthday cake that you're making, which is the human body, starts from the molecules found inside the bloodstream. If the recipe is showing 14 eggs per 1 cup of flour, we talked
Yep.
about it last week, you're going to end
Sure.
up with a
Uh,
birthday cake you probably wouldn't want to
An
eat, and you
omelet.
definitely wouldn't.
Yeah. Maybe for breakfast.
Yeah,
Yeah.
you wouldn't want to share that with your friends for a birthday party. But that's what's happening to that level, and you understand the ingredients much better than most people, even without a PhD science degree. You understand ingredients inside food, and you understand how to make things, and that's exactly what happens inside the bloodstream. The life of the flesh is in the
Yep.
blood. Everything is inside there. So today we can see the recipes and we can adjust the recipes.
Well, it's the first law of thermodynamics, right, Doc? Is you can only make a change. You can't get rid of something that occurs
That's
naturally,
it. Big Bang.
biologically. Yeah.
That's right. Big Bang. God said, snap my fingers. I think I heard it, said the evolutionist. And here we all are. But it's a fun thing to learn. And once you understand it, boy, it allows you a little bit of peace, right? Now that you
Okay.
understand why in the past you got anxious sometimes, why you had those racing thoughts, and why you didn't feel so. And now you're as peaceful as a lark. It's that understanding that if something were out of range, you could always go to the bloodstream, always go back to the source and figure out what happened, right?
So,
So
yep. So what is this cause here, doctor? What would you identify this cause as? It's not
uh-huh.
labeled at 9 months.
Yeah, so
Um,
this is a young man that came to see us, Jay, and he said, I've been wearing hair fibers, topic hair fibers for 12 years, covering all this hair loss. Nothing worked. I tried the Rogaine, you see over there. I tried Propecia, and nothing was working for him. So this was him on the left. This is him after trying everything else on Earth. That was the results. That's our before.
yeah.
After everybody on Earth gets a hold of them, we then get a hold of them, as you mentioned, Jay. So we take them as they are. We took a look at the blood work and it was very straightforward. The algorithm told us what to do. We put him on a daily supplement based on his blood work, and this is him 9 months later.
Now,
He's referred 10 or 12 people.
are those fibers involved there as well, or is that his own natural hair?
Jay, he was so excited. He said, I'm so happy I don't have to wear fibers ever again. No, he stopped wearing the fibers. The fibers are great for occasions, once a week, once a month, where you're trying to look at your best, but they are not a daily application. And today, Jay, most men, the majority of men, are using fibers daily, nightly. Imagine that black tarry stuff all over your head and having to wash it in, wash it out every single day. So the
Yeah.
answer, no, guys, no to the fibers. Yes, I think fibers are great to use on occasion, but why not grow your real hair? It's easy to do. We just have to give you a daily supplement based on your blood work. And 9 months later, Jay, 270 days, look at this man. Okay.
That looks
9 months.
fantastic.
Yeah. So this
Yeah.
is 9 months here. This will be also, I'll send this over so you can have this on your portal so others can see it. 9 month case here, 9 months here, Jay. Unbelievable. And that's what he told me. He said, wow. And I said to him, wow. Now, it just all depends on what we find inside the bloodstream. So this young man here had a little problem with nutrition, some of the sugar
Yep.
problems. So as we reduce the sugar, as we increase the protein, as we increase the HDL, we allow the body a new recipe of ingredients to make chemistry, right? And then we get
Yep.
in there and we regulate the enzymes to allow it to create the perfect chemistry. And this is the results of perfect optimized chemistry.
And it looks to me as well that those people are probably working the nutrition side pretty hard. Pretty.
That Jay, that's the key. They say after talking to Tracy and Jay and learning what I should be doing, it's not that people want to do the wrong thing, Jay. It's they don't know what the right thing to do
Yep.
is, because today you hear it from all different sides and everybody's an expert, and boy,
And
it's too many smart people and not enough knowledge.
let me tell you, the FDA doesn't make it any easier with their labeling systems and how they measure things, and it's not very conducive to learning. I say to always try to measure your sugar grams in grams and count them, and you'd be surprised how quick those numbers add up.
You better believe it's a pay to play society, the westernized civilization. So we basically tell the human, use your own thinking cap, right? Don't put the laser cap on there. That doesn't work. But use your own thinking cap to make decisions. And unfortunately today, it's easy for big companies and big corporations to make the decisions seem very easy, even though they're the wrong decisions.
That's very true. Okay, so 12
So
months, and
yeah.
what was she presenting with when she came in, Doc?
Yeah, no, this was a young lady that came in and tried vitamins, shampoos, and a lot of times the males don't do the PRP, the putting the needles in the head, Jay.
Yeah.
They take blood out of your system, they spin it around in a cup, and they
It
put it right
yeah.
back in there, and they charge you about 250, 350,
Just
450, $750 in Beverly Hills, but it's not going to
it's
work,
it's
Jay.
not going to stop the cause, and it's eventually going to catch up to you.
Yeah, so eventually, so she tried that for months and months, and after a couple of years of the hair thinning, she said, "I got to do something else." So we took a look at the blood work and found out that her
Yeah.
nutrition was great. She had one enzyme defect. All we had to do was create a supplement with one enzyme regulator, Jay, and this is the result.
So women are, women have this inherited enzyme activity, or one or both. It it doesn't, you know, decipher gender, or women have testosterone, or the same type of issues, correct, doctor? Can you kind of go into that because there's a misunderstanding out there?
Yeah, well, Jay, that most, I would say, if I had to guess, that 75% of our patients today have at least a master's level, if not a PhD. They're educated, so they understand a lot about molecules and testosterone
Yeah,
and estrogen and how things move around. They may not understand all of the algorithms that we've developed, but they have an understanding of hormones that can change shapes. And by changing shapes, they change function. So, as you
yeah,
mentioned and alluded to, we have a different set and different levels, but everyone has the same types of chemicals. So
okay,
imagine you have 4,000 chemicals. Everybody's got them. Men have some a little bit higher, makes a man. Women have a little bit, some of the other ones that are higher that make them more women. And that's the way it works. But once you start regulating the enzymes, you have
yeah,
to be careful which direction, up, down, left, right, that you go. So only with precision, with the blood work, can you detail where exactly that molecule wants to go. And that's based on the genetic predisposition, based on the defects in the enzymes that are located in the cells. So I think that's something to maybe take away is inside the bloodstream is the factory,
yeah,
right? That's where we're making stuff. But then they'd have to leave the bloodstream and go into the outside, the skin and the
hmm,
cells, and that's the hair cells. So we're inside the bloodstream making new enzymes. Over the course of 3 months, those new enzymes go find new homes inside defective enzymes, hair cells, and then they kick out the old enzymes, reprogram the DNA inside the hair cell from the inside. Sounds like science
yeah.
fiction, but it
And
happens
then
every single time.
and then it goes to a bucket, I think, right, doc?
It's all about
But
buckets, Jay.
but
So
well,
you and I have to determine which bucket
that's
it's going to go in.
that's a different conversation. So I see up here at 12 months and 10 years
Look at this,
finasteride. So
Jay.
is that a prostate cancer patient? Because
Well,
I see finasteride, and
you
that's
would
what
think
they
so.
use to treat it, right?
You would think so, Jay. This patient on the left, this is after 10 years of consistent finasteride
Yeah,
at 1 to 2 milligrams every single day, doctor. It got worse and worse and worse until he said, I've got to do something different. Okay.
that's
We took a
terrible.
look at his blood work. The ratio, the enzyme defect was still apparent inside his bloodstream on this molecule finasteride. And that's what we see today is we can see inside the bloodstream if
Yeah,
what you were doing did work, Jay. It will reveal itself in your bloodstream. So anyone that's trying something out there, there's a lot of people trying programs. Get your blood work. You don't even have to start our program.
yeah.
Get the blood work to find out if what you're doing is doing anything. Is it even working, or is it truly a sugar pill? And you'll find out most people's molecules they're taking are ineffective, meaning they do not change your internal biochemistry. And that's what you worry about. People are worried about taking a medicine and something bad happening,
Yeah.
Jay. 99% of the time, you're going to take something and nothing is going to happen. That's how hard it is to make a chemical reaction change inside your bloodstream. It's not as if you could take something and bad stuff happens. That would be very easy, but it's hard to unlock all the keys inside your body to change anything. So to get
And
the change, so
yeah,
that what I want to point out about this patient, Jay, is not only did the hair thicken up, look at the color and the texture of
yeah,
all
sure,
of the other
absolutely.
hairs. So it's not just those 5 zones that you're losing hair that improve, it's all of your hair. Because remember, we're
Yep.
treating the internal side of you. We're treating all of the bloodstream inside that's treating all of the cells on the outside. So I always expect the skin cells, the muscle cells, the hair cells, all of the cells in your body will improve on the program.
That is true. I've noticed myself that the hairs are thicker when they grow back with the topical. And back to, the other slide, it's just borderline negligence to prescribe something without taking blood for it, I think. And to be clear, Stop and Regrow doesn't subscribe to finasteride, or that's not something that is in your your enzyme we'll say replacement or therapy supplement capsule. You don't use finasteride, is that correct?
And so the first thing we do is look at the bloodstream. We find out what is the cause of their hair loss. Then we look at what is the most effective molecules that we have. The
Yep.
first thing we're going to teach everyone that comes into the office is that finasteride at any milligram dosage is ineffective. Finasteride will never, ever stop your hair loss. Finasteride will never, ever regrow your hair. I've never seen a patient come in that's on finasteride ever grow hair, Jay. So I'm
Yep.
very confident
And
about that.
that's and it's also about 40 years old, isn't it? I mean, I'm sure there's been more advanced molecular findings than finasteride.
Right. And well, we talk about a term called half-lives of medicine, and we could do that
Yep.
another
Yeah.
discussion. But half-lives tell us basically how long something is going to last. So a day lasts for 24 hours.
Yep.
So if you're taking a capsule every day, whatever is inside it must last for 24 hours.
Yeah.
If it doesn't last for 24 hours, that molecule, then it will not be effective. The finasteride molecule, once it enters the human bloodstream, Jay, once you've taken the finasteride and it gets absorbed in the bloodstream in about 45 minutes, from that time, that finasteride will only last for 6 hours. You
Yep.
test your bloodstream in 6 hours, there is no finasteride in your bloodstream. So
So,
what
yep.
you took lasted for 6 hours. For 18 hours,
Doesn't make sense. You have to take,
as if you'd
yeah,
have to take it 4 times a day, Jay.
that doesn't make sense. You'd be losing sleep to do that. And wow, unbelievable.
Welcome to Earth. Welcome to Earth. But this is how the majority of the affluent American society, the first world, is living. You would think
Yep.
this would be the third world. If we were talking to third world people, it would make more sense that they're not educated. They don't have the knowledge. But in a world where it's a pay to play society,
Yep.
the underlying goal is not to give them everything that's truthful. The underlying goal, unfortunately, is to get you over to my team, get you over to my
Yep.
side. And if you're
Yep.
not working with us, you're not going to get them over to the cure. Okay. So this is a patient here, 12 months, tried vitamin, shampoos, PRP, and look at that, just 12 months. I'll scroll through these a little
Yep.
quicker. I know we don't have a ton of time, but here's another one, Jay, 12 months, vitamin, shampoos, Propecia. Shampoos, vitamin, diet,
Yeah.
laser cap,
Uh-huh.
PRP, Propecia, Rogaine.
All
Tried it all, doc.
all external. All external.
Yeah, and
Yeah.
this is us 12 months later.
Yeah.
Okay, here we
That's
go.
great.
Andy from the back grew it in 12 months. In the back here, 12 months. Tried Propecia, minoxidil, the Rogaine for 5 years. So the picture on the left is a after picture after 5 years with minoxidil and Propecia on the left. That's their after picture. That's
Wow.
our before picture.
Hmm.
We'll take everybody's after, Jay, and we'll take that as our before picture.
You can
Our
almost,
picture on the
yeah.
right is after 12 months. So after 5 years of Propecia minoxidil, you have the picture on the left.
Yep.
After only 12 months of precision supplements and topical, you have the results on the right.
And you can even see at the scalp level that there on the left,
uh,
that irritation from the alcohol, right? And the
that's
scalp
it.
on the
Yeah.
right, the regrowth, which is water based, you have that nice healthy white scalp without the irritation. You can see it clearly from here.
That's it, Jay. It's as clear as day. So when people are trying to decide between us and someone else, there's not a decision. It's knowledge. Knowledge will
Yep.
separate the decision making process. Okay. So
Yep, for
zone
sure.
five in the back, right? The grape turns into a baseball that turns into a softball. We've got to stop it before it turns into a volleyball.
That's
Right.
right.
So we took the softball, turned it into a grape now. He's got a little grape left after 12 months. So the question you asked was time frame.
Yeah, that's what
Okay.
everyone wants to
So
know, doctor. Everyone
so
wants
here we go.
that's
So
yep.
so this result here, 12 months, zone five closing up from where we are after 12 months. I would say 2 years, and he's going to have a ponytail holder. Okay. So
Right?
from this point, how long will it take us to get to the finish line? So about another probably 24 months from this page right here.
And it'll also be interesting to see the lab results of those people when they, their sugars and, their HDL fats and what those look like.
You got it, Jay. I had a patient come in today for his annual review, and he looked amazing. The before and afters, we should post it. You can share it with the followers. Pictures are amazing. He feels amazing. We review his blood work. I think he's 50 years old. His free testosterone jumped from 600 to 800.
Wow,
His good free testosterone jumped from 11 to 17.
that's incredible.
His DHT level dropped from 80 to 6.
How about
So
the sugar?
yeah, the sugar, he came in at 5.1,
Us-
worked with our nutrition, which is very good. We're shooting for
Yeah,
5.0. He
yeah,
works with our nutritionist, ends up with 4.9.
that's great. That's incredible. Those are great results, Doc.
Yeah, so here we go, Jay. I'll just scroll through a few more here. So 12 months, diet, shampoos, and supplements. And this is us after 12 months. Here's a young lady. So it seems like the laser cap, a lot of women are more doing the laser cap than the PRP
Yep,
injectables, and men are more of the capsule related the treatments. So here she was with a laser cap, putting that on for about an hour a day for years, and it wasn't working. And then we said, please eBay the laser cap, give it to
yep,
an enemy, not a friend, right? You only give stuff that works to a friend, Jay. If
yep.
it's not going to work for you, don't just give that to a friend who's looking for something. That's not fair.
Yeah,
Okay.
well,
So just
yeah.
put it on
They
eBay
say
or give it to an enemy.
to treat people how you want to be treated. So,
That's it. So you
you
tried it
know,
for 3 years. It didn't work for you. Don't give that to a
no,
friend
no.
of yours just because you're getting rid of it. Throw that
Well,
thing away or give it to an eBay.
it's just, people need to just realize that it's not an external type thing you can treat from the outside. It's from the inside. And the only way is to get your blood work done, and with a specialist like yourself, the only specialist that has the biomarkers to run this algorithm. You're not going to go down to your local doctor or the hospital downtown and order this test. It's impossible. So, all right.
That's
So what
it,
do we
Jay.
have here, doctor? 14 months, laser
14
comb,
months, female
same
came in.
story,
That's it.
all
Same, very
external.
similar story, right? So you see the softball and the grape, and the softball
Yep.
has closed. Now we're left with a little grape, and over time, so from here, I would probably say another 16, 18 months, and it should be a full recovery.
That's excellent. So, people drop in their questions, comments, and then we'll get back to them, and we'll make sure to get this information out. Doctor, thank you very much. You have more slides, or
All right, Jay,
um,
we've got slides upon
you can
slides
keep
upon slides.
and
We can
and
go for
and you have on the website a lot of these before and afters, and people always say, "Yeah, well, you guys, you put the best ones up there. You only put people are very hesitant.
Jay, I don't have the time and the
Yeah,
staff to put up the photos. I've
right.
got more. Jay, we just made a poster on the outside of the office, and I put up the 6 best ones we
Yeah,
had, and then weeks later, we got 4 best ones that beat those best ones. The brochure I put out last year with the best photos have best ones out. Jay, it only gets
it's
better and
it.
better and best. The only people not growing hair today are the people that have not found us and have not found you. If you call Jay, you will find us and you will grow your hair by the end of the year.
Yeah, it's a matter of priorities. It's a matter of follow through and wanting to make a change. In order to make
That's
any
it.
kind of change, you have to take a step, to do it. So, doctor, thanks for your time. Next week, maybe we could jump into how the bucket works, testosterone, free testosterone. Also, I've been researching these mammalian proteins and how perhaps overnight you have a time released effect with the capsaicin proteins and things like that. So
Oh
we
yeah,
can have another discussion next week about that kind of stuff and how it relates to the bucket list, and we'll kind of continue on that path and slowly get our message out there.
you got
So,
it. I
Dr.
appreciate you.
Nettles,
Thank you.
thank you for your time. God bless. We'll talk to you next week.
Thank you, Jay.
Have a good week.
You too, my friend.